ain't it great that we can fly probes to Mars and so on, but we can't, the people are still waiting for their food stamps, or or insurance won't pay out their medical bill and so on. So I believe it is time for honesty. Where it's just not a priority for the people in power to fix these things.
Well, I think that's certainly sadly true. I mean, I think it's obvious in some respects. I mean, look at this in the United States of America. I mean, we have national health care. I don't know how good it is or how workable it is right now, but the thing is, what's the problem? I mean, we're the only country in the world that didn't have a national. I mean, the only advanced country in the world that didn't have any.
That's correct.
Until very recently, and then ours is just getting off the ground. And it's amazing. I mean, part of this is, yes, a political system and blockages that impede justice, but also some of it is perhaps just unfortunately, the moral weakness, the lack of moral development or evolution that allows this to happen. I mean, when I was when during the political campaign, I guess it was the last political campaign, when President Obama was coming out with his health care plan, and just the tirade, all the anger, that it was just. I mean, it's one thing I just can't get. I mean, people were concerned about keeping their doctor, the particular doctor, and the fact that you have other people, they either don't get help, or if they do get help, they're broke for the rest of their lives, because the American system is obscenely expensive. It's obscenely, ridiculously expensive.
I don't think we can't treat our citizens like this and then call ourselves civilized. That's another area we've got to be honest.
So I need a more. So my thing is, it's a kind of a moral depravity, as well as perhaps an economic depravity, and they kind of work together.
And possibly even corporatocracy, like the idea that all these elected officials are promising certain what do you call it when they donate? Those who donate to their political campaigns. So let's say a big pharma company donates to Obama. Well, that donation doesn't come for free. He's promising certain things, even if it's just a handshake agreement.
Right.
Yeah.
Right. Well, we're getting near the end. I was just wondering. One thing we didn't talk about too much is the medical-industrial complex, which that is, I kind of alluded to that, the general issue of medical care, but that is also equally insidious. And
and I mean that's not really a conspiracy theory. It's most doctors are acknowledging it now. It's just a huge problem with big pharma being so rich that they can buy evidence to get a drug released. They can buy scientists. It's just the level of corruption there is unbelievable.
Yeah, it really is, and there seems to be no incentive to develop cures if there's no profit, which in and of itself is oxymoronic when you think about it. That's another, maybe a topic for another day, but the idea that profit can be the single motivation for development, because sometimes it just doesn't work.
It's. I mean, I'm essentially a capitalist. I'm not a socialist, but I believe it's the best of a bad bunch, probably, of all the economic systems.
I agree.
And I think profit can drive. There are moral companies, there are moral elite businessmen, but at the end of the day, it needs the people to monitor all this. And when you take them out of the picture, when they don't have a voice, you've just got huge corporate machines, and that's what you call unregulated capitalism.
Right. Well, unfortunately, we're just about at the end of the show, James. This has been really interesting to me, and I really hope you can come again to join me in this show and talk more about all these different subjects that you